My topic is binocular vision testing. So before going into the topic proper, I think we'll go through the basics. What is binocular single vision? We can go through the definition of binocular single vision, what is written here. So in simple, what it means that each eye is perceiving two separate images, and these two images are seen as a single one with a three-dimensional picture with the ability of fusion and stereopsis. So these are the three grades of binocular single vision: simultaneous perception, fusion, and stereopsis. So simultaneous perception is the most elementary type of binocular single vision. It is the ability to see two dissimilar objects simultaneously. Here you can see the right eye seeing the parrot, the left eye seeing a cage, and you'll be seeing both together, and that is simultaneous macular perception. In fusion, it is the same, slightly dissimilar, same image what is being seen. So the right eye sees the house with a pot on the right side. The left eye sees a slightly dissimilar image with a pot on the left side. When these two images are fused together, the patient with binocular single vision will see the house with pots on either sides. Similarly, this is the picture of the rabbit also with the bunch of flowers. And in stereopsis, the patient slightly horizontally disseparate retinal elements are stimulated, and the patient appreciates a three-dimensional picture. Now, what are corresponding retinal points? Retinal points are the two eyes which share a common subjective visual direction. You can see the fovea of the left eye and the right eye has got a common visual direction in space. So the fovea of both eyes are corresponding retinal points. But when it comes to the extrafoveal point, a temporal point on the right fovea corresponds to the nasal point on the left eye. So these two are corresponding retinal points. So this again can be of two different types. Normal retinal correspondence, when both fovea has got a common visual direction, as you see in the picture. And anomalous retinal correspondence, or ARC, where the fovea of one eye will be corresponding to an extrafoveal point of the other eye. This usually occurs when there is a small angle manifest squint. So those are normal retinal correspondence and anomalous retinal correspondence. And what is diplopia and confusion? Diplopia occurs when non-corresponding retinal areas, as you can see in the picture, the fovea of the left eye and an extrafoveal point on the right eye is being stimulated by the same object. So this is stimulating the right fovea, a left fovea, and an extrafoveal point on the right eye. So this right eye extrafoveal point has got another visual direction. So that will be seen as the same object will be seen as double, that is diplopia. In confusion, it is corresponding retinal areas are stimulated by two different objects. The left fovea is stimulated by the circle, the right fovea by the triangle. Both are having a same primary visual direction. The patient will be seeing both circle and the triangle. So he will be confused which one he is seeing. So this is again of diplopia, extra non-corresponding retinal areas being stimulated by the same object. Now, this is always difficult to patient. Both confusion and diplopia are difficult for the patient. So there will be an active inhibitory mechanism where the image of one eye will be temporarily inhibited. To avoid confusion, one fovea will be inhibited, and to avoid diplopia, the extrafoveal point will be suppressed. So that is suppression. Now, coming to the proper binocular single vision test, the aim of which is to assess the presence or absence of normal retinal correspondence, or ARC, suppression, simultaneous perception, fusion, and stereopsis. I hope all of you have understood what are all these terminologies. Now, these are the binocular single vision tests, various tests what you have, which is commonly used: work for dot, Bagolini, red filter after image, for prism diopter, base out test, stereo acuity. I will go through the simpler ones which is commonly used in this limited period of time. And these are the stereo acuity tests which are available. We'll go through each of it. Now, before doing a binocular single vision, it's always mandatory to check the visual acuity of the patient, because a reasonably good vision in both eyes is required to have a proper binocular single vision. Always assess the fixation in the squinting eye and the direction and size of deviation also. Now, coming to the work dot test, this is a commonly used dissociation test which can be used for both distance and near fixation. It helps to differentiate BSV, anomalous correspondence, and suppression. The procedure is the patient wears a red-green goggle, and by convention, red before the right and green before the left, and the patient views a box of light with four lights, two red, one green, and one will be white light. So the results how it is interpreted are, if the patient sees all the four lights, if the patient is says he is seeing all the four lights, red, two green, and the white, which is a mixture of red and green, that means the patient is having binocular single vision, provided he doesn't have any squint. If the patient says he is seeing the four lights, but he has a small manifest deviation, then that is anomalous retinal correspondence. If the patient sees two red lights alone, that means he's not seeing with his left eye, so he's having a left suppression. Seeing three green lights, then it is right suppression. Suppose a patient says he sees three green lights and two red lights, that means he's seeing with both eyes but separately. So that is diplopia. And some patients may tell at alternately they are seeing the green lights, and then sometime they are seeing the red light. That means the patient is having alternate suppression. In case this occurs in cases when they are wide angle squints with which is freely alternating. Coming to the Bagolini striated glasses, which again helps to differentiate VSV, ARC, and suppression. And the Bagolini glasses has got two lenses. Each lens has got fine striations, which will convert a point source of light into an oblique line. And the lens is placed as 45-degree and 135-degree in front of each eye. And the patient is asked to fixate at a small light source. Each eye will perceive an oblique line of light, which is perpendicular to either eye. So if this eye sees an oblique line, this, and the left eye will be seeing a perpendicular oblique line. And how will you interpret the results of the test? If the patient says sees two streaks as an oblique cross, that means the patient is having binocular single vision, provided he doesn't have any squint. If he's seeing the cross in the presence of a small angle squint, that means he's having anomalous retinal correspondence. If the patient sees a cross with a small gap in between, there's a small gap in between in one oblique line, then the patient is having microtropia. The patient, if he says he's seeing two lines but not as a cross, seeing two lines but not as a cross, that means it is diplopia. And if the patient sees only one line, it is either left suppression or right suppression, depending upon the direction of the line. So that is Bagolini's test. We'll go to the stereo acuity test, which Sir wanted me to speak more of it. Synoptophore, I think it will not be possible to cover it in this 10 minutes, so I'll go through the other test. The TNO test, which uses the red-green goggles for dissociation. The Randot and the Titmus fly stereo test, which use Polaroid spectacles. And the Lange stereo test and Frisbee test, where no dissociation glasses are used. The Lange stereo test, no haploscopic glasses are used. So the advantage of this is that the eye movements of the patient can be better observed by the examiner. Especially this is useful in pre-verbal children. And the dissociation without this haploscopic glasses is ensured by half cylindrical lens laminated on the surface of the test plate, which make only one image visible to either eye, and which can be fused together to create a three-dimensional vision, provided the patient has got binocular single vision. Now, these are the Lange test plates. You have the Lange stereo test 1 and Lange stereo test 2. In 1, you have 3 objects visible, a car, a cat, and the star. Depending upon which the patient is, only patients with BSV will identify this. So depending upon which image the patient is identifying, the stereo acuity can be graded from 550, 1200 to 550. Actually, patient with 550 has got a better stereo acuity. In Lange stereo test 1, you have 4 objects, a moon, a car or truck, an elephant, and a star. And the star will be visible to all patients even with monocular vision. Those without binocular vision will also see the star, but only patients with proper binocular single vision, depending upon what is the grade as it is given here, they will see all the other pictures. The Titmus stereo acuity test use the Polaroid spectacles, and it is a near stereo acuity test which is done at 40 centimeters. Actually, you have to measure the distance 40 centimeters and keep the test plate there. And this is a test plate what you see. On the right side of the test plate, you have a fly, the picture of a fly. You should ask the patient to pinch on the wing of the fly. That is what you ask the patient. Some patients may either pinch it on the surface and some may pinch it on in the air slightly away from the plate. So if the patient is pinching it in the air at a distance from the plate, that means he has got a gross stereopsis of 3500 seconds of an hour. Suppose he is pinching it on the surface of the plate, that means he doesn't have any stereopsis. Now you check for other grades of single binocular vision for the patient. You ask the patient to say whether any letter is visible at the bottom. If the patient says he's seeing the L, that means he is having right suppression. If he says he is seeing R, that means it is left suppression. If he sees both, that means he doesn't have stereopsis because he was pinching on the surface of the plate, but he has fusion. Now, after this, if the patient doesn't has some amount of stereopsis, you go to the left side of the test plate, which has got circles, which are called the word circles, and these word circles, there are 9 sets of circles, and each set will be having 4 circles, and one of the circle will be projecting forwards towards the patient. You ask the patient to touch on the circle which is projecting out, and it then test the range of stereo. Suppose a patient, this is ranges from 800 here to last test plate will be 40 seconds of an hour. Suppose one patient is telling that he can identify the circles projecting out up to the fifth one, that means then his stereo acuity is 100 seconds of an hour. In children, you can use the lower one, which is the animal test. You ask the child to touch on the animal which is projecting towards him, and depending upon that, the range of stereo acuity from 400 to 100 seconds of an hour can be found out. In random stereo acuity test, which is again using Polaroid spectacles and done at 40 centimeters, again a near stereo acuity test. Here you use Julius random dot background, which shows geometric figures like square, circles, triangle, and star, etc. These are devoid of monocular clues, unlike the animal and word circles. And the range of acuity tested here is between 500 to 20 seconds of an hour. These are the geometric figures, what you get in the chart. And this is the stereo test, random stereo test chart, what you're seeing. In TNO test, you use the red-green goggles for dissociation. This is the red-green goggle. Here again, you use the geometrical figures, and the range of acuity tested is between 480 to 15 seconds of an hour. In the Frisbee stereo test, you are again not using any haploscopic glasses. Here you have 3 sets of plates of varying thickness, that is 6 millimeter, 3 millimeter, and 1.5 millimeter. Each plate has got 4 squares. Each plate has 4 squares, and of this, 3 squares have got random pattern of blue triangles. And in the fourth plate, there will be a circular area which is devoid of these random pattern. So in that area, suppose you have a plate here in the central, one square has got a circular area which is devoid of the plate. On the other face of the that plate, you have this corresponding to that circular area. You have these pattern put over there, and the plate
Dalia,
is held.
please point up Dalia.
Okay, sir. 2 more minutes. The plate is held in front of the whiteboard, and the patient with stereo acuity will see the circle projecting out. And altering the thickness and distance of plate from the subject can assess different stereo acuities. So the patient viewing it from 30 seconds, if he is viewing the 6 millimeter plate, it is 600, 3 millimeter 300, 1.5, and the range of acuity tested is from 600 to 20. Now the recording of stereo acuity, whether it is for near or distance, if it is without correction, it is SC, with correction, it is CC, and the seconds of an hour for the last correct response for 2 consecutive incorrect responses. For the circles, if the patient was seeing the fifth one, it is 100 seconds of an hour. If the patient doesn't identify any target, it is no stereopsis, and always record the name of the test. For example, stereo at near without correction, 60 seconds of an hour, and TNO test is used. The smaller the stereo acuity value, better is the stereopsis of the patient. With 100 and 600, 100 patient will be having better stereo acuity, and the normal value is 40 seconds, which may go even up to 15 seconds in some patients. And the refractive correction should always be worn by the patient. The room light should be goodly illuminated. Always instruct the patient what to do and allow sufficient time to perceive. Do not touch the test plate, which may manipulate it. And the patient without deviation, always, if they have no stereo acuity, suspect micropropia. and you perform at least two stereo acuity tests for better interpretation of your patient. So the take-home message is binocular single vision anomalies are common and it can affect any age. It is mostly considered to be an anomaly and not a pathology. Even though it is not sight-threatening, it can affect the quality of life of the patient, including scholastic performance and even the daily routine activities. Always when and whom to do the BSV test has to be chosen or do a comprehensive ocular examination with history, refraction completely, and check accommodation and convergence before you take the patient for a binocular single vision test. Thank you.